again, so don't worry. Maybe it's summer, maybe for next semester. I'm trying to teach you theoric one, also with video, trying to practice one. And we will repeat together, maybe next semester, again for practice. About the exams and final exams and practical exams also, I will inform you. Okay? So I'm going to start. Today's topics, excuse me. Today's topics is about the parental solution, IV and IV injections, drugs, and blood transfusion. Yes. Okay. About the outline, today we will speak about the body pollution, movement, electrolyte, goal of the parental solution, type of the solution, and electrolyte balance. And I will speak about basic informations about the IV systems in the body. But I'm sure you know all of this in the high school, but we need a little basic informations. So after that, we are going to nursing processing. So I don't speak long about this. Also, I put the old PowerPoint in PDF in the system. You can read it again. If you have questions, you can ask me. In fact, about the 45–75% of the body weight is water. And this is portions decrease with age. The fat persons have less also. And in women also less than the men's, you know. About the acid and base and balance in the body infected all body functions in the body functions. You will see the fluids is located inside the cells about the 70% and outside the cells about the 30%. Intravascular fluids like liquid, protein, blood. Other ones located between the cells and outside the cells. And the third one located in cerebroperitoneal and synovial fluid. And movement of the water and electrolytes with three types is movement. First one is diffusions. Diffusion is passive movement because the particles from area with higher concentrations going to less concentration. So it don't need to energy. But the second one from area with lower concentrations to higher concentrations. So in this type needs the energy. And the third one is about is osmosis. I'm sure you know about the osmosis. The wall of the cells and the liquids between outside and inside can move. But anything like sodium, potassium can't move easily, and it means it happens with osmosis events. And osmolality of the blood, of the plasma, serum blood is about 20 to 18 to up to 300. About the goals of the parental treatments, to give the vitamins, to give the drugs, the acid-base balance, to administer the medication. And about the type of the solution, we have three types of this: isotonic solution, hypotonic, and hypertonic. The isotonic solutions have the same osmolality with plasma. The hypotonic solution have the lower than the serums. So we use that for example, in high serum glucose levels, and hypertonic solutions have higher than the serum osmolality. For example, in risk of the edema, regular urine output, we use this type of the serums. There is a figure you can see here. What happened? It is isotonic solution, hypotonic and hypertonic solutions. And there is a table here. You can see the example for isotonic solution, hypotonic solution, and hypertonic solution. Just you can see, don't need to remember that all the time. Another important thing you must know about the body deficit, it's the turgor. You can check your hand in your body also with your fingers. When deficit happens, when you touch like this, it needs more time to come back the normal reflex. And another one is we checking the edema, the code. If you press, it needs more time to back. During the pregnancy, more time the legs it's happened, for example. So the brain characteristics of the fluid volume deficit is maybe weight loss over short time, decreased easting and third, dry motion members, urine output 10 than 30 milliliters per hour, and wake repeat pulse. This means. And maybe flat neck vein in the supine position, hematocrit is limited. And Nelson invention for fluid volume deficit. What is that? At first, we must check about the gag reflex. Why patients can't eating liquids? Maybe patients have vomiting, nausea. Maybe you need to give the drugs for PRN. Check the patients about the ability for GPN systems. Maybe you need to moisturize the skin and change the position for patients in this situation. And intake output checking is too important. And electrolyte balance, about the electrolyte balance, sodium, potassium, calcium, and magnesium, these are too important. And this is the level, normal serum level of this. You can check there. If the electrolyte imbalance when happened, for example, many time of this disease, like there are endocrine disorders and metabolic systems disease, it happens also. In intravenous therapy, what we are doing, but our purpose is giving the fluid, liquids. Maybe it's be blood, maybe it's be drugs, maybe long time we need to infusions, and we must the information basic about the which drugs we are using, because for example during the injections maybe any reactions happens, so nursing must know about the reactions, and if reactions happens what must do, and which vein, which cannula, how type of the way we are choosing. And these are for the goal of the IV fluid, and the nursing must know about this. So I speak about that, and for example, here I put any pictures. Here, for example, about the volume control. These are a pump rate, These are for make the rate. For example, long time patients need to use the heparin. They need, it's better the using heparin pump. Here you see the how they put the serum sets. Maybe these are in plastic one, maybe in bottle, glass one. And it's very important things. Another important thing, aseptic techniques in all procedures is important. Also in IV is more important because during the IV injections, IV therapy, the aseptic technique is important because maybe causes to infections. And in these pictures you see, and we must write the nursing name, which time it started, when it's finished, how GTT per minutes must running, and these are more important. That and about the set, which time we started. For example, the serum sets many times just you can use for 3 days. After 3 days, you must change that. Also the vein, for example, if you're using the right hand, for example, after 2-3 days, you need to change another hands. So you must need, and before the starting and after then, you must write also document it. And this picture shows the injections from maybe patient have the serum setting is running, and during that needs to inject it the drugs. This is a they say this 3-way. At the same time, they added the serum set and drugs also using, and maybe 2 ways, 2 serums, 3 cannula they need at the same times. We can do also. And also we must know about the IV therapy complications, maybe infiltration. Infiltrations most time happen to elderly people because they have a problem, they veins. Phlebotomies also, and it's painful. You need to put the warm pack and hypersensitivity and choice. The drug is very important. Many drugs, for example, if you use the hand, there is a tendons. Depend on which drug is running. You must be careful. Maybe drugs causes to necrosis in the hand tendons. So it's better you use another veins. And in this process, if any of the complications happen, you must cut and write and change the place using another vein. And for example, I have a therapy from my hand. After 2 days, 3 days, you need to change that. It's better don't use same place, another place, same vein, because it causes to necrosis and problems for patients. We speak about that. And stop the infusions, remove that, elevate the limb, check the patient's pulse, vital sign, and document it, and checks the site. Yes, nursing that. And educated the patient is too important, you know. In all procedures, all the time I'm saying, educated the patients is important. If patients know about what happens, it's better. So about the reasons, times when it's finished, about the complications, educated the patients. Maybe you have for example, you are sick, you go to the hospital, you have a long time antibiotic units to use. So every day you must go and inject it. In these situations, maybe see they put the cannula in your hand and they don't take out. And about 4 days, 3 days, this is in your hands, and you are going and use the same way, for example. So you need to educate the patients. And another important things about the how dosage we calculate. It's too important. You see the drops per minute, how we calculate this. Total infusions, for example, if it says 1 liter, you must write here 1000, because 1 liter, how many milliliter? 1000. So, for example, if it's 500, multiply to 20. Why 20? Because in 1 milliliter, there is 20 GTT, 20 drops. So all the time is same. It's not changing. And total rate in 60 multiply, because in 1 hour, 60 minutes. So you will find the drops per minute. For example, when is the this right to give the 500 milliliter solution 4 hours? You can calculate that. Can you? It's about 42. Please, everybody, try that. Now I want you to do any videos about the injections. I'm open for you.
The B-Braun Intracan Safety IV catheter with passive safety technology. Safe and easy to use, resulting in first stick success. B-Braun's proprietary universal bevel on the Intracan Safety IV catheter is a super sharp needle that provides flexibility of insertion angles. The universal bevel creates a V-shaped tricuspid incision, resulting in a flexible pathway for easy and smooth catheter insertion. The result is less tearing and faster healing, greater comfort for clinicians and patients. Intracan Safety's double flashback technology improves first stick success through quick visualization of both the needle flash and the catheter flash. Here's how the double flashback technology delivers this benefit. Upon insertion, the first flashback of blood, needle flash, is visible in the clear flashback chamber, confirming the needle tip is in the vein. Using the push-off plate on the catheter hub, the catheter is advanced forward off the needle into the vein. A second flashback, catheter flash, occurs between the catheter and the needle, confirming that the catheter is successfully in the vein. Once the catheter is advanced completely, the needle is withdrawn in a swift, continuous motion. The safety shield on the B-Braun Intracan Safety IV catheter engages as the needle passes through the catheter hub. It deploys automatically and permanently shields the needle tip. This safety feature cannot be bypassed and is designed to protect against needle stick injuries. The removable vented flash provides additional versatility to the Intracan Safety IV catheter. The flash plug can be replaced with a syringe or blood collection access device prior to insertion, or loosened to speed blood return during catheter insertion. After needle removal, this feature allows the clinician to obtain a droplet of blood for procedures such as monitoring glucose or hemoglobin levels. The B-Braun Intracan Safety IV catheter. Safe and easy to use, resulting in first stick success. The Introcan Safety IV catheter, integrated, easy to use, and featuring a truly classic safety mechanism that protects both clinicians and patients. In a moment, we're going to see the entire procedure for properly inserting the Introcan Safety IV catheter. By closely observing how the Introcan Safety IV catheter is used, you will better understand its features, advantages, and what it means to patients and clinicians. Ms. Thompson is being prepared for a minor operation. The nurse will start an IV with normal saline. This will maintain an open line and allow for administration of fluids and IV medications during surgery. Before initiating the procedure, the nurse confirms Ms. Thompson's identification by asking the patient to state her name and by checking her wristband. Then the nurse calmly and reassuringly tells the patient why IV access is necessary and explains the procedure. The nurse has decided to establish peripheral IV access via the patient's metacarpal vein by inserting a 22-gauge Introcan Safety IV catheter. The first step is to gather and prepare all necessary equipment. In addition to the Introcan Safety IV catheter, she will need gloves, antiseptic solution, tourniquet, mechanical securement device, transparent dressing, and an identification label. All these items may be included in a sterile IV start kit. She will also need a sharps container. After checking the IV bag and primed IV tubing, the nurse is ready to begin. Before we watch the procedure, let's take a moment to review some key features of the Introcan Safety IV catheter. Introcan safety needles are very sharp to allow for a greater flexibility of insertion angle and to promote smooth insertion. Introcan Safety has a transparent catheter hub that is color-coded to indicate the catheter's gauge. The Introcan Safety push-off plate allows for one-handed insertion of the catheter and also serves as a bevel orientation indicator, proper alignment of the bevel throughout the insertion. The Introcan Safety flashback chamber, which catches blood return to indicate venous access, is a cylinder designed with ribs to give the clinician a secure grip during catheter insertion. Introcan also features a removable vented flash plug. The flash plug can be loosened to increase the speed of blood return, or it can be replaced with another device, such as a syringe or a blood collection access device. One of the most significant features of Introcan Safety is its passive safety clip. Prior to catheter insertion, the passive safety clip is housed within the transparent catheter hub. As we'll see in a moment, the clip is automatically engaged during needle removal to permanently cover the needle tip. This technology simplifies safety procedures and assures safety compliance. Now that we know a little more about the Introcan Safety IV catheter's features, let's see how proper insertion is accomplished. After washing her hands, the nurse is ready. She ties the tourniquet around the patient's arm about 6 inches above the insertion site and asks the patient to make a fist and squeeze tightly 4 to 6 times. With the tourniquet in place, she cleanses the skin with an antimicrobial solution around the insertion site and allows it to air dry. She places on gloves and then removes the protective cap from the 22-gauge Introcan Safety IV catheter. Without touching the cleansed area, she stabilizes the vein by stretching the skin and holding it taut. With the other hand, she grips the Introcan Safety IV catheter by its flashback chamber and holds it at an appropriate angle over the vein. Using a smooth, steady motion, the nurse inserts Introcan Safety through the skin and into the vein. The sharpness of the Introcan Safety needle allows for smooth venipuncture and minimizes patient pain. A consistent layer of lubrication along the catheter also helps facilitate the easy insertion. After observing blood return in the flashback chamber, the nurse lowers the device parallel to the skin and advances the needle and catheter together 1/8 of an inch into the vein. Then she uses the push-off plate to thread the catheter into the vein. The Introcan Safety push-off plate is located on the middle of the hub to minimize the risk of hub contamination by the nurse's finger. The nurse releases the tourniquet. Before removing the needle, the nurse uses the V technique to simultaneously occlude the vein and stabilize the catheter hub. This technique minimizes blood spillage from the vein and prevents dislodgement of the catheter during needle removal. The nurse withdraws the needle with a swift, continuous motion parallel to the skin. The needle glides through the clip smoothly. As the needle tip exits the hook, the passive safety clip is automatically engaged. This safety feature requires no user activation and cannot be bypassed. The clip permanently shields the needle tip, preventing reinsertion of the needle into the catheter and protecting the clinician from an accidental needle stick injury. The nurse connects the extension set to the catheter hub. She covers the puncture site with a sterile, transparent dressing. She then stabilizes the catheter using a mechanical securement device. The nurse connects the primary IV set to the extension set. And writes the date, time, size of catheter, and her initials on an identification label. Ms. Thompson's Introcan Safety IV catheter is now in place. All sharps should be properly disposed of in the sharps container. Now that you have observed the proper insertion of the Introcan Safety IV catheter and reviewed some of its key features, you can better understand the many benefits Introcan Safety IV catheters provide to both clinicians and patients.
Okay. The second topic is about the blood transfusion. When we know the blood transfusion, maybe there is the volume for blood in bleeding, maybe whole blood, maybe blood compensations, name is. About the blood compensation, you know, two basic components. The first one is cellular elements. 47% include white BC, red BC, and 55% plasma, include protein, lipid, water, and vitamins, etc. I'm sure everybody know about the blood groups, and you know which is your blood groups. We called it with A, B, O, or AB, and with RH, positive or negative. And very important things we must know about. We must know that, for example, which groups can give and take from which groups. For example, the A can keep from A and O, B from O and B, and AB from all of these, and O just give for all of them. And about the RH, when it's your blood type is positive, you can take the blood from positive one and negative one, same. But when it's negative, just from negative one. So when the blood, you give the blood test examination, you write the pack, which type is the blood, and you must check the patient's blood type. If what happened, for example, if I am patients, my group type is O negative, and you inject it in my body, O positive or another blood type. This causes the hemolysis, and it's dangerous position and causes to the death for patients. So it's too important being careful. And blood transfusions is the rule of the nursing. You must, in the hospital, if they need to blood transfusion, you must take it from lab. You must write, you must check the name of the patients, order physicians, group types, negative, positive, everything. And it's my when I work in hospital, I understand that. For example, your friends, another nurse comes and says, "I check it." You don't to check, don't accept. It's too important. With yourself you must check, and don't leave be near the patients during the injections, during the blood running and after that, because you need to check the vital sign before, during, and after that. You must check from reactions and everything. And if reactions happens, you must cutting the running. You need the drugs. You must have informations, basic informations. But if the hemolysis happens, if the reactions happens, what you must to do. After in PowerPoint, we speak about that. So transportation is responsibility of the nursing, and from hemolysis you must check the first important things and date. And another important thing is the because blood is in a cold weather keep in the lab. So if take it and inject it for patients, it causes to dangerous positions. So you need to waiting in room temperatures, same temperature like room and body after you can inject it. And it's important things two nurses check if it's true. And you must check also blood pack or plasma with your eyes also. For example, during the plasma, it's liquid, white, and there isn't anything inside. If you see anything in blood pack, causes that it's hemolysis happened, you can't use that blood. Making a match about the ABO blood type, RH positive or negative, cross match, antibiotic test, antibiotic screening for the such diseases like HIV infections, hepatitis C, hepatitis B. About the donor, history of the donor is too important. About the disease, for example, syphilis, HIV, examination for blood for ELISA. This is also tested about the, not just like syphilis and HIV, more groups of the disease check in ELISA, and blood group and cross matching must check. And another important things about the donor, be least higher than 7 years old, should be at least 50 kilogram. In women's, hemoglobin higher than 12. In men's, higher than 13 and a half. And patients don't have, for example, dentist problems. I go to dentist during 1 year before, or surgery before 1 year before. And before that, you must check the vital signs of the patients. About the whole blood and cellular production, it may be whole blood, red BC, leukocyte, white BC, and platelets. Different type of this in lab there is. I put all of them, just you check, just see, it's enough for you. And during the injections, what, for example, most of them, be careful about the temperature, checking with your eyes, and using just with normal saline. But in platelets, another important things during the using the platelet, also they use the excuse me, about the white BC, they use also antibiotics they give during the injections for patients. And another things, examination for the blood before transfusion. I said about the name, age, sex, blood, physician orders. Blood bottle should be checked twice, not once. Maybe you are doing wrong. About the check about the hemolysis. Then there are clear line between and serum, and should be clot information. Blood containing clot should be not used also. Before the transfusion, you need to check the patients, I said, and vital sign, name of the patients. You can ask the patient's name. Maybe there is a barcode name in patient's hand. Check that. The document also, and be sure the patient is true. Number of the black package. the type of the blood, date, blood groups, and it must check with two nurses. Before transition is aseptic, and aseptic techniques, it's too important. Check the physician's orders, I'm repeating just, and vital sign. And about the temperature of the pack during the transposition, and during the transposition also you must be near the patients because any reactions may be happened. Don't leave the patients. Taking the vital sign during the injections, start with a slow rate. You can't use with high rate, and monitorize during the if any complications happen, you must cut. And after I will say you at the end if reactions happen, what we must do. After transposition, also again vital sign. If patients can't speak, ask any. Maybe patient says I have vomiting and like this. You must write starting type, date, the time, which time is finished, which finished, while vital sign, before, during, ending, all of them must chart it. And patient in comfortable. Right? And about the complications, maybe causes to hemophilia, allergy, hypocalcemia, circulation overload, all of them maybe happens, and you must know. The first thing we must do, cut the infusions. Yes, I said maybe hypothermia, hypocalcemia, potassium intoxins. Maybe patients have for example, vomiting problems. After the blood checking in lab, you can understand what happened. But these are the reactions maybe happens during the injections. This is a sample for blood. There is a barcode, and also top of them from lab, they write the name of the patients, which services, which date, and basic information. And in nursing interventions for blood transfusion complication, what is? Stop the infusion, give the normal saline, take vital sign, monitor the transposition and symptoms, and medicines maybe be ready, like steroid, antihistamines may be ready, because maybe complications happens and you need to quickly do that, use that. And the blood package should be sent to the blood bank. What's the problems? Because, okay, and this is easy one. And the second one is intravenous, about the medications. But before that, I want to share the video with you also. I think it's really better. There is a 3 video open for you. Okay, please watching that and after.
I'm just going to put tourniquet on. It's going to be a little tight. If it's too tight, let me know. Just squeeze your hands for me. Just open and close, open and close. Now just relax your hands for me.
Did you see this cannula, for example, with color, pink? The different color means that the different size of the cannula. And be careful about the degree.
So I feel some cold water going up your arm. Let me know if there's any pain. How does that feel? Yeah, absolutely. Still feel okay? Yeah. Okay, it's all done.
If you don't see the videos, also the videos are in the systems. You can upload all of them. You can see, you can watch them. And the third topic of today is about the intravenous medication, intravenous veins medications. Now, did you see the presentation? Are you see? Okay. About the outlines, about the advantage of the IV, the purpose of the IV injections, and the selecting the vein, the true cannula, using the vein, we put the tourniquet, complications, and remove and dressing the cannula. In this presentation, we will speak about the administering the medical intravenously. What is the advantage and chance in intravenous injections? The drugs truly going to the all of the body, and it's maybe you need the high volume, so the IV is true way, and it's affected not slowly, quickly. Maybe you need the quickly affected for patients. It's emergency, so the IV is the better than the intramuscles or another type of the injections. Burçin Hoca teach you. But the important things you must know. If you inject it in the body, it's then quickly affected, so you haven't chance and you haven't more time to. If you cut it also at the all of the body, the drug is all of the body, so it's very disadvantage, and you must be careful. And there is a different type for IV injections, and different place, different vein we can use, different size of the cannula we are using. With high level of the drugs we can inject it. Many times you need the IV injection must do. For example, patients going to the operation room, all the time you will see they will open the IV line. It's important. Maybe during the surgery, any complications happens, any bleedings happens, it must be a vein, open vein. A vein is open and ready to inject it the drugs. So this advantage of the IV. About the disadvantage, it's about the allergy, and during the injection maybe causes the reactions like vomiting. These are disadvantages. And aseptic techniques is too important. If you don't be careful about the aseptic techniques, causes the infections. Now I'm going to the yes, about the disadvantage. Maybe causes to vertigo, flushing, hypertensions also. So many times where you are injecting the drugs, I'm sure all of you, when you sick, you use the antibiotic. They injected the, for example, antibiotic, like penicillin. Before they injected penicillin, they tested for allergic. After then, during the injected, they injected very slowly, for example, and check if you are feeling, for example, the reactions, they cut that. And many times we say, for example, if your parents have penicillin, many of type of the antibiotics, and once you are a nurse, after finishing the courses, you can inject it. Don't accept to inject it any type of the drugs like penicillin at home, because if allergic reactions happens, you can't do anything in home. And for example, in penicillin, maybe your friend says 2 years, 3 years before I use the penicillin and there isn't reactions for allergic. Don't accept. Each time maybe happens. About selecting the vein, which vein we are using, which veins. The first one we looking that if you have a, for example, surgery or be in the hospital, you see at first they checking in your hand. The first choosing in the hand surface, hand veins good. And I will in the wait please. the pictures. You can see better. Dorsometacarpal veins in the first choice many times. Did you see? In fat patients, maybe adding the cannula and IV lines difficult. But for example, like me, it's too easy to find. Easily you can see. You can check your hands. And about your arms, everybody opens the arms and you can see if you push your hands above 5-10 centimeters up then the veins you decided to choose, you will see the veins and the first which see which one is better you can use. But many times patients have a problems, for example in shock, hypervolemy, you can't find the vein, you can't see. It's the what we must do. Many times the first choice is hands, but it depends on the drugs you are using. For example, many drugs and many high doses causes to necrosis because in the hand there is a tendons, many tendons. So be careful about this. So depend on the drugs, you must also choose the veins. About the adults, we don't use the legs stangers, but in infants they are using. And it's important. Another important thing about the flexity. If you, for example, cut the catheter during here, patient can't move. It's also important. And I am, for example, using my right hand. So it's better ask the patients if the patients using their right hand, is better cut the catheter in the hand left side. And many times, for example, in mastectomy, it's forbidden. If the patients have the mastectomy in left side of the body, it's forbidden to using the left side for injections. And also, if you, before I say it about that, if you use the right hand, it's better for another injections, use the left one, and not same place, not same vein. It causes to necrosis because about the cannula, the cannula also have a different size, and top of the pack they write about the each a gauge, and with different color. You will see in green, in blue, you will see in pink. Also write the gauges with different the needles long and it's thick, so have different size. For example, if the gauge is 16, it's more time larger volume, so it's too thick and too thin. But the 24 and 20 times is smaller in children and elderly they are using. But from the color also you can guess. And if you check also the pack, you will see the different size of the needle, and you must choice depend on the patient. This one is good. There is what we need for a drug, for example, injections. You can see. About the tourniquet, it's important things. About the 5, for example, if you are injected in my hands, you use this vein, 5-10 centimeters up, inches above, and says the patient, you will see the veins. And be careful about the, for example, when you're opening or push the tourniquet, it's painful. Be careful. When the procedure is finished, quickly open that. Don't forget, many times nursing forget the tourniquet. I see the hospital. It's about the tourniquet. And it's better use the one using tourniquet to prevent the infections. But there isn't. In hospital, there is a 2-3 tourniquet for all patients they use. But after using, you must cleaning that with disinfections. Which antiseptic solutions they use depend on the hospital, depend on the procedure of the disease control and preventions. and chloride gluconate solution, for example, they says is using. But the important thing is also which drugs you are using. You can read top of that. For example, maybe you need 30 seconds, maybe you need 2 or 3 minutes to effect the drugs you are using. You must wait. I said one used, maybe you can use. It's the degree, which degree choice with, for example, with right hand, put the needles, with left hands, keep the hands to immobility, and with 15 to which degree? 5 to 15 degree. If you're using in hand, 5 to 10. If you're using another place, 5 to 15 degrees. It's good. But in hand, 5 to 10 degree. Okay? There is the transparent design. After using, you can use. If there isn't, you can put the bottom with alcohol and press. And history of the patients is important. If patients, for example, using any drugs like elderly patients using heparin, for example, you must 2-3 minutes wait with patients. Keep with your hands. If you leave the patient, causes the bleeding because how you using the how you cleaning, how the apply the tourniquet. These are all pictures. Insert the cannula. Immobilize with another hand the vein, because if you don't keep with another hand, it will be moving and it's too difficult to insert the needles. Did you see? After inserting the needles, they cut it out. When they see the blooding inside the cannula, it means then it's, yes, it's in the vein. After, they will add the serum sets. With history. And top of them, they must write the name, time, person's name, so insert the catheter also. And charted it in the patient's documents also. About the removing the cannula and dressing, you must turn off the serum sets. Check the vital sign also. Using the bottom of alcohol, moisturizing the place, it will cause us to easy opening. And with high and away, open the strip. After, take off the cannula. And about 1 or 2 minutes, you must press also and leave every place. Did you see? This is showing the how they removing, how we removing, and waiting. Okay. The end of my presentations, dear students. If you have questions, I can answer. Also, there is a PowerPoint and videos in the system. You can check there. If you have questions, you can write me email. You can want me repeat it again also. I will do. For next week, about the respiratory systems, I will have a course with you. I will edit the videos and PowerPoint and PDF in the systems. After, I will inform you for live class also. Now I'm waiting for questions. If you have questions, please. And I'm happy today sees you. Many of you have pictures. I'm remembering you. About the exam, I will inform you. Maybe one project, like a project, because we can do the exam for lab. We can use the lab. So maybe planning care plan for patients. For example, I will write, for example, Mr. A have this disease, needs to IV catheter, and write me the steps of the IV catheter. I give you before the checklist. You can read them. And about the exam, I will speak with Burçin Hoca. Maybe test, live exam, or maybe like a project. And for example, 1 day, 2 days, and you must do and send me. I will write for you. I'm not sure about this. I will write for you because after that I have respiratory systems. After that, 2 more topics about I think about sleep disorders and carrying diet after diet. So just this. After finished, I will inform you. Now for next week, I will write for you, and I will say you the example. How? Okay. My email address there is. If you have questions, please write for me. Okay. You have. I think you have exams tomorrow. Histology. So I hope good exams for you. Okay. Good evening. Thank you for listening to me. I will send the video also in the systems who can't join live. And thank you. Bye.